Today we've come back to Glasgow for a very special visit. We've come to Stobhill Hospital, home of the Pigeon Lung research team, and we're going to talk to Dr Gavin Boyd, who is the pioneer into the research. Good morning, Dr Boyd.
Good morning.
Thanks very much for having us along here today. Can you tell us one or two things about the pigeon lung disease?
That's going to be difficult in just 1 or 2 minutes because it's really a very big problem. I think the real thing that we have to understand is that allergy and an allergic reaction to pigeons amongst pigeon fanciers is really very common. And if you go back through some of the medical writings as far back as the early 50s, you find that there is information that suggests that up to 20% of pigeon fanciers might well be affected by this allergic response. Now, since 1965, I and my team have been involved in various levels of research into these allergic types of reaction, and the pigeon lung problem has become a fascination to me, and I think once I linked up with Dr Lynch and his vast experience of pigeon fancying and the pigeon fancier, it really became a very important part of the research here in Glasgow. The allergic reaction that affects pigeon fanciers is something which is not like asthma, and it's not an infection like psittacosis. It's a response of the body defense system to exposure to pigeon protein. And the pigeon protein, as you all know, the important thing is the bloom. Yeah. And exposure to excessive amounts of pigeon bloom in fanciers who are sensitized to the pigeon protein can produce an allergic reaction and can produce problems with breathing and with lung disease.
Yeah. Is there an increase in recent years in the fanciers with pigeon lung disease?
Well, we've been very conscious that pigeon fanciers themselves are much more aware of the pigeon reaction and of pigeon lung. And our own efforts, I think, at trying to publicise information about the condition has made us feel that many more people are aware of the problem, and many more people very sensibly wear masks of the right sort to prevent the inhalation and the breathing in of the bloom particles into the lungs. Yeah. So that I think the evidence that we have still suggests that up to 30% of pigeon fanciers, certainly in the UK, are sensitised to their pigeons. Not all of them will have pigeon lung, and that proportion of the pigeon fanciers in total is probably in the region of 15%.
Yeah, because in recent years, with the introduction of wheelwood flying and a darkness system, fanciers are now used in closed-in lofts. Do you think it's wise to have a closed-in loft?
I think if you react to your pigeons, and I think if you have positive evidence in the blood test, for instance, that you have a sensitized response to the pigeons, then you must wear a mask. And any situation where the level of bloom is higher than normal is one that you've got to be careful about and avoid if possible.
Yeah.
So if you're working in a closed situation and with higher temperature, I mean, you know the level of bloom tends to rise in this situation, and that's one you have to avoid.
Yeah, so it's advisable really if you to use an aviary type loft if you're
I'm not going to tell pigeon fanciers how to raise their pigeons, but I mean the truth is, if your lungs or if you are sensitized, then you have to be able to adjust the way you make contact with the birds to limit the amount of bloom that you're exposed to and that you breathe in.
So say if you're allergic, it doesn't mean you've got to pack up pigeons, does it?
Oh no, absolutely not. I mean, the truth is I would never tell a pigeon man to give up his pigeons.
Yeah,
what I will tell him, and what the research is geared to, is to provide a pigeon man or woman with the information about their health, and then they must make up their own minds.
Yeah, because I recently done an article actually on a chap that had it very bad, and he got an open loft, like a rabbit hutch type loft, and he's now racing pigeons today very happily.
Well, I think that's a good story, and I think that's one that we should always keep in mind, because there are others, and I mean, every pigeon fancier has a story of somebody that he or she knows that has been in contact with the medical profession, and they've said, give up the pigeons.
Yeah, I've heard that loads of times, and it's quite unnecessary, really.
Well, it worries me, because I think there are many ways that thinking people can look at their problem and look for ways to get around it.
Yeah, definitely. It's quite easy to get tested, isn't it?
Oh, it's very easy, yes. I mean, part of the research exercise which we run is to try to help pigeon fanciers, and as part of the response to the research funding that the Pigeon Fancier provides for me to carry out the various basic research activities, we try to provide on a free basis the pigeon blood test.
Yeah, and they can also be done at shows. You attend shows, don't you?
Well, that's right. That's the other sort of main contact with the fancier. But I mean, in truth, for the individual who's worried about the chest or worried about the possibility that they might be sensitised to the pigeons, all they have to do is to get their doctor or the practice nurse to send a blood sample up to us here in Glasgow, and we can process it for them.
So what are the general symptoms?
Well, I think the classic symptom is a picture like the flu. Flu-like aches and pains with a high temperature, shivering, feverishness, sweating and feeling rotten, and that coming on 4 to 6 hours after often fairly heavy contact with the bird. So it's the sort of thing that comes on after a marking session or on a Saturday after a race, and when the contact in the loft with the birds has been greater than usual. The other problems relate to dry, irritating cough, and of course to shortness of breath. And shortness of breath and the general sort of reduction in the level of physical reserve is something which can creep up on people, and they only suddenly become aware that they can no longer run anymore, and or they get breathless after they're climbing a flight of stairs, or they have to stop when they're walking up hills. So that feverish problems, sweats, shiveriness, flu-like feelings, a dry, irritating, tickly cough, and shortness of breath. These are the main things.
Yeah. Can it be treated with drugs?
I think the real treatment is to avoid heavy exposure to bloom and to get the level of exposure to the pigeons below that which triggers off the clinical problem.
Yeah. Can a fancier actually get cured?
I don't think anybody can be cured.
No,
Pigeon fancying, I mean, I think if that's in your blood, that's part of you. And I think the pigeon lung problem is a bit similar. If you're sensitised to pigeons, you will always be sensitised to pigeons. What you can try to do, and what we are really exploring with all the research activity, is to find a way that can ensure that people can continue contact, but in fact do not get the problems associated with the pigeon lung.
Well, Dr Boyd, thank you very much for talking to us this morning, and well done on your wonderful work.
Well, thank you, and thanks for taking the time, and good fancying to everybody, and look after your health, it's very important.
Thank you.
Get many feet.
Do I get a Smartie after?
Depends, you've got to be a good boy. There we are, it's very simple.